everyone to today's session of CESI Talks. My name is Mateusz Vandrzejewski, and today with me is Mihail Palimarciuc. I hope I said it more or less correctly. He will correct me in a second. Mihai is policy analyst at the European Policy Center. We are happy to have you here again because we had already an interview with you in June, I remember. And you're basically standing behind this great publication, well-performing public service for a fair and resilient European society. It's a great literature about the future of public service and also how it looks right now. And regarding to this, today we have prepared a few questions to you. Dear Mihail, thank you for your time, firstly. And what do you think? What has been the impact of the pandemic on the public service across the European Union?
Well, hello, and thank you for inviting me. It's been a pleasure, and it is a pleasure now as well to speak with you. Public services have been impacted in different ways. It's very hard to pinpoint on exactly one sentence and say that this has been the impact of the pandemic because it differs between different sectors, but also between countries. However, it is fair to say that public services, like many other businesses, had to adapt to disruptions in their supply chains, but also had more issues because many of public services and many public service workers were deemed as essential workers and they were exposed to many risks, while others had to adapt drastically and very fast to a new way of supplying their services. And I would say that in the end, the impact of COVID-19 has been quite different. So I would just give some examples that satisfaction with schooling, online schooling has been quite varied across Europe, with Southern and Eastern Europe performing worse and with Northern Europe and Western Europe performing better. But also comparing online schooling with healthcare, some people would argue that it performed better with just like taking on the extra pressure, but also making sure that the population didn't have any unmet medical needs. So this is a complex reality with very complex responses and different impacts. But I would say that in the end, taking a grosso modo approach, I think what can be said is that there has been a lot of stress to adapt and a lot of stress to respond.
Yeah, I mean, this is, I think, what we can all observe speaking to our family and friends, that there was a lot of struggles and stress when you're related to the public service that we all as citizens consume anyhow. And as you said, school, I remember we had yesterday a discussion with some friends coming from Northern Europe and also then me from Germany. And I only hear complaining about the school system online in Germany, and the others were super happy about it. So yeah, there we have a huge varieties of the public service across the European Union. But what do you think, what should the European Union do to support the member states for a better public service?
Yeah, I think that the list of priorities is big. And I would start with just saying that Europe is currently doing quite a lot. It has finances and it has some spending priorities. So for example, I would just like to say that public sector modernization is one of the flagships for investment and reforms in the RFF. So this is something quite good. And just looking at some of the national plans for resilience and for spending this money, you can see that different different public services have been identified as in need of reform. And I'll just give one small example in Romania, where healthcare has been identified many times by previous European assessments in the European semester as being like need of more investment, and there are plans of creating a national agency for development of health infrastructure. So all of this is great, but I think that, you know, stepping from what is been happening right now is I would think that what the Commission has to do and what the EU has to do is to support and to create a public service agenda, so that even before, after the initial, you know, shock and countries going from crisis response to long-term response to the pandemic, to increase investment, so to have a European semester and to have a governance structure that is prioritizing investment and will not allow consolidation and reducing investment and creating austerity. So I think this is very important in the long term for the Commission to keep its eyes on how countries are responding and to promote investment.
Yeah, thank you. I fully agree. I think from the last crisis that we had, we all could learn that austerity is not the key to to solve the problems that we are facing right now. Mihai, thank you very much. I would say that's all for today. The time is running. I just would like to mention that this whole interview is running under the project CESI Talks, and which is running by the WEP, We European Parliament. And by this little interviews, we want to introduce to our followers, to our members, the work on the European level, and you as the EPC are part of it, a very important part of it. So thank you once more for your time, and yeah, see you next time. Bye bye.